Good afternoon. Welcome to day 248 at the County EMA office, where we bring you the latest on the COVID numbers. Joined here with Chairman Mark Kern and Sam Behrman from the Health Department. And Sam, it's through the roof.
It is. I think every day we want to have that hope that we are going to see better numbers, and we get a little bit of a decent day with going down, and then we shoot right back up. So as of today, 135,627 St. Clair County residents have been tested, which is an increase of 1,944 from yesterday. And we are at 11,851 positive test results, which is an increase of 279, which is our highest one-day raise since we've started. And that does include both males and females from under the age of 1 up to their 90s. Our daily county positivity rate today is 14.4%. We are at 123,776 negative test results. And unfortunately, we are announcing 3 additional deaths today, which does bring our total for the county to 237. We had a male in his 60s and a male in his 70s, both with unknown health conditions, and a female in her 70s with pre-existing health conditions. And as always, our condolences go out to their families. For those who have completed the IDPH required 10-day isolation period, we are at 9,708. For state totals, 9,161,453 have been tested, with 585,248 positive test results, which is an increase of 11,632 from yesterday. And for deaths, the state is reporting 10,779, which is an increase of 37 from yesterday. For hospitalization numbers in St. Clair County, currently we have 109 individuals that are admitted due to COVID-related reasons, and 11 of them are on ventilators. And regionally, we have 220 individuals that are admitted due to COVID-related reasons, and 21 of them are on ventilators. For our congregate living facilities that are currently or previously been in outbreak status, and we will only announce any facilities that have had changes, Caseyville Nursing and Rehab is at 52 cases and 2 deaths, and that is an increase of 8 cases for that facility. Cedar Ridge of Lebanon has 88 cases and 16 deaths, which is an increase of 3 cases. And Marca Nursing and Rehab has 27 cases and no deaths, and that is an increase of 3 cases. We do have some testing this week. Tomorrow, Tuesday, November 17th, from 10 a.m. to 12 p.m., and from 1 p.m. to 3 p.m. at the Clair Fairgrounds in downtown Belleville. And then on Thursday, November 19th, from 2 p.m. to 6 p.m., this is the first time we've done one after 4 p.m., so from 2 p.m. to 6 p.m. at Clair Fairgrounds as well. For any of that specific information, they are both listed on the Health Department Facebook page as well as the EMA Facebook page. And I will turn it over to Chairman Kern for his update.
So Sam, a huge number of people tested today, 1,944 tests, 279 positive. Anyone that wants to try to argue with numbers and say that testing really doesn't show what's going on, I mean, that's a good portion of the county got tested, and that's a lot of people that have COVID.
It is, and I think especially with the rise that we've seen in the numbers and with the upcoming holidays, people are being smart. They're getting tested. No one wants to spread this to their families, especially around the holidays. So we encourage everyone that has not been tested, if you are interested, please go out and get tested so we can help slow the spread of this virus.
But keep those gatherings small.
Absolutely. To those that are, you see daily within your daily bubble, within your household, that's the best way to stay safe.
And we had another manufacturer announce a vaccine today that is about 95% effectual. So that, this is all good news. It shows that if we can just wear our masks, wash our hands, watch our social distance, we can get through this. A vaccine isn't going to do it all by itself. We got to get to the point where we can get this vaccine twice to be able to be immune.
And as ready as we all are for this to be over and for us to be able to go back to, what we're going to call our normal day-to-day life, I was on a conference call this morning that said slow and steady. And I mean, really, that is what we have to do. We have to do what we can and look forward for the day that we actually have the vaccine, that, we're going to be able to give it to all of St. Clair County and all over the state and the country and move forward.
because the other number that goes along with this, COVID patients, 109 in St. Clair County hospitals, 220 in the region. Those healthcare workers, they're wearing out. The
They
doctors,
are
the nurses.
at their maximum. They absolutely are. Not only are they at the maximum for the beds that they have available to put patients in, but their staff is, almost exceeding capacity. They've been on those front lines. They're exhausted. They're getting sick. So, it's a whole picture.
It's really civic duty to wear this mask.
It is.
It is the only way we're going to get through this pandemic. So we encourage people to do that.
Absolutely.
Thanks, Sam, very much. So we'll read the zip code numbers. You'll note a lot of them have gone up significantly today. In 62201, we went up 5 to 340. 62203, up 6 to 343. 62204, up 7 to 207. 62205, up 10 to 305. 62206, up 6 to 606. 62207, up 8 to 331. 62208, up 17 to 682. 62220, up 22 to 862. 62221, up 30 to 1,099. 62223, up 15 to 754. 62226, up 28 to 1,260. 62232, up 11 to 330. 62239, up 1 to 170. 62240, up 1 to 61. 62243, up 5 to 230. 62254, up 9 to 389. 62257, up 2 to 82. 62258, up 12 to 393. 62260, up 6 to 278. 62264, up 1 to 133. 62269, up 40 to 1,090. And 62285, up 2 to 234. 1,944 people tested, 279 positives, mean our daily county positivity is 14.4%. That brings our 7-day rolling average to a high 14.9%. Remember, we got to be at that 6.5% level or lower. We got this rate down to the low fives, even the high fours at one point about a month ago, and we can get back there, but we gotta do all the right things. Wear the mask, wash the hands, watch the social distancing. Stay home if you really don't need to go out. If it's not essential, the best way to avoid COVID is just to stay home. And if you can, for now, that is what you should do. In addition, we recommend go to your local restaurants and get carry-out, get takeout. Let's keep these businesses staying in business, and a good way to do that is to patronize them, to buy the food from them, take it home, eat it at home. Perhaps the ambiance might not be what it is in your favorite restaurant, but you'll be safe and you'll be keeping your local establishments in business. So we encourage you to go out and do the takeout thing, even more than normal, more than you normally would. The state has our regional positivity today pegged at 16.3%. They get that by Bond County being at 9.7%, Clinton County 15.1%, Madison County 15.9%, Monroe County 19.7%, Randolph County 31.9%, St. Clair 14.3%, and Washington County 15.9%. So Herb, it's not just St. Clair County, it really is the region is having real problems with COVID-19. The numbers are still growing at a bad time because we hit the holiday with a high number, and we know just by past experience, whether it was Memorial Day or the 4th of July or Halloween, that holidays are a time when people, I don't know if they get careless. I don't know if it's just that they're with people they don't normally see, but we tend to see numbers spike after a holiday. So this is not a good situation.
It's not good. The picture is getting gloomer every day. We started off this morning on the phone with Sam at the health department, and we knew right away that the numbers were going to be high today. And I can always tell when I get that early morning call from her. It's the bad numbers. But if you look at that regional percentage, where yesterday was 15.3, and today it's 16.3. So it is steadily climbing, and we keep telling everybody every day. And then if you look at under 40 years of age, 127 of those cases. So again, when I see the people out there that say, "Oh, it's only affecting the elderly or in the long term," that's not even holding water anymore. I mean, this is everywhere. When you have 127 cases of people under 40 years of age, that ought to send a signal itself that the younger population is really got to put the brakes on and stop doing what they're doing. We're up to 237 deaths in our county alone, and again, we see people every day saying, "Well, that's a small percentage." We say it, one death's too many, and I would just Randy and I was talking about it early this morning during a little get together we had here at the office. If there was an accident that took place at a major intersection here in the county, and we're averaging a death a day from an accident, people would be up in arms wanting something done with that intersection. This is day 248, and we've lost 237 people in this county. People, we need to really pay a lot more attention. And I know Team St. Clair is doing everything they can. I get those messages, we get those phone calls, we come in and they're recording the messages. We appreciate all of that, the support, the way you're spreading the word around. We just got to continue. Now we got to put a foot on the brake. We got to slow these numbers down because, as the chairman said, if more mitigations come, people's not going to be happy. We got to help our businesses. We got to help ourselves, and we do that by following the 3 W's that we've been preaching for 248 days. And it's just not us. It's every community. We just heard today down in Monroe County put out an article in the newspaper where they're pleading for people to help.
So continue sharing this feed.
Yes.
Maybe you haven't done it for a while. Let's get the numbers. Let's grow the numbers of people who are watching this. It's imperative that we're able to get this message out. When we have numbers like these, we want to make sure everybody knows about them. Not everyone reads the newspaper. Not everyone listens to the radio or watches television, and so this way we can get the numbers out to people, let them know just what it is today and how we're not where we were a month ago. We're not in a place where we're comfortable with the numbers. That they're declining. They are no longer declining. They're rising, and they're rising at quite an alarming rate.
Well, and one of the questions that we had a while back, were the counties and the regions working together? Yes, the health departments communicate back and forth all the time. Today is the first day the courthouse was limited to, shut off from the general public. Several other city halls and courthouses that followed suit doing the same thing.
It's by appointment only.
By appointment only, of course. Business has still got to go on, and so we want that. But I think it's a way that we're trying to tell people, let's take a harder look. This surge that we got going on now, if it continues, it's going to blow us out of the water where we were several months ago, and we don't want that. So please, let's continue to spread the word, as the chairman said, and keep hoping and praying that this vaccine gets here and they get a good program set up for that, and we'll get through this. We'll be back with Daisy in just a few moments to translate this into our Spanish communities, and we'll be back tomorrow for day 249.
We must find a way to live with COVID-19 until a vaccine is ready. One proven thing we know is that masks do work. By wearing a mask, you can do your part to help your community by limiting the spread of the virus and thus helping our businesses remain open and our hospitals able to handle the capacity. To get through this virus, we must work together as a team, and you should do your part by wearing your mask, washing your hands, and watching your social distancing.